I want to actually answer a very important question that you could likely see in an exam or a viva, that's like an oral exam. So they could ask you that breastfeeding in general within the 6 months could actually prevent pregnancy. But why is it that they lay so much emphasis on nighttime breastfeeding? Okay, so the reason is just very simple, right? So for the one me I know is that at the nighttime prolactin levels seem to go up more. Okay, I don't really know a reason for that. Probably this lecture could actually tell us a reason for that. But nighttime breastfeeding is actually very important in actually stopping further pregnancies or newer pregnancies because the prolactin levels usually shoot up. So it contributes to natural pregnancy. Why? Because prolactin levels is very high during the night. So if you breastfeed during the night, like it's likely to go high during the night. Okay, so if you breastfeed during the night, it's likely to go higher, stop pregnancy more. Do you understand? So it's actually part of a lactational mineral method, okay, and it's 98% very effective. Okay, so nighttime nursing plays a crucial role in suppressing fertility because it has an impact on hormone regulation. So prolactin levels will rise during nighttime feedings, especially between 1 a.m. and 6 a.m. So for the mothers that actually complain that my baby doesn't allow me sleep and all of that, you can take your time and actually sleep in the daytime, because in the night, the feeding in the night is very, very important. So as the prolactin goes on so high, it actually has an impact on the gonadotropin releasing hormone, okay, which will have an impact on the follicle-stimulating hormone and the luteinizing hormone. All right, which will now stop egg release for menstruation. So there will be no egg for fertilization, of course. So frequent suckling at night helps to maintain a hormonal environment that keeps menstruation and ovulation suppressed. Now, long gaps between feeding, especially overnight, can lead to a drop in prolactin, and there's a risk that the mother will actually get pregnant again. So the advantage is on the baby, is receiving nutrition, is growing fast, while the mother, at least it will stop you the issue, it will reduce you the stress, of getting pregnant again. Okay, so what are the conditions for you to say that this lactational mineral method will work? The baby should be less than 6 months. So we're not saying over 6 months. If you are breastfeeding your baby, it can really help to cushion up things, right? But we're saying within the 6 months is when we are very sure that this method always works. Okay, the mother has not received menstruation, she has not received menstruation, then the baby is exclusively breastfed. When you say a baby is exclusively breastfed, there's no formulas, there's no additional food, and all of that. So when these conditions are met, you can be sure that lactational mineral method will be 98% very effective. Okay, so when fertility may return is if the night feedings decline. Okay, if supplemental feeding come in, the mother is tired, she's feeling like her breast will go flat, you understand? If menstruation resumes, so all these changes should now trigger the mother that, okay, if she still doesn't want to get pregnant at that time, she could actually go in for another method of what do you call it, another method of contraception.